Hi, my name is Daniel Baer, and I'm a professor in the Faculty of Social and Community Services, and I've been studying drugs policy for just about 20 years now. And I started studying drugs policy because I realized that there was a real problem in our society that wasn't being addressed well. And when we got to a period a couple of years ago and thinking about a good social innovation project, I realized that one of the biggest areas we needed to disrupt was the way in which we conduct drugs education. And so we developed what became known as the Engaging and Educating Young Adult Cannabis Consumers Project, because we wanted to understand where young people who were consuming cannabis were getting information about cannabis, who they were getting the information from, what information they wanted, and who they wanted to deliver that information. So we worked with cannabis consumers, bud tenders, and public health experts and students here in the Bachelor of Creative Advertising program at Humber to develop new cannabis education materials that were free from stigma and free from harm, free from all of the misinformation that I had grown up with in the 80s with the DARE program, which was called Drug Abuse Resistance Education, which just tried to scare people and stigmatize drug use. We wanted to get rid of all of those ideas and create something new, built in a co-design process with people who actually were using the material. And so that's what we did. A project like this wouldn't have been able to take place without research funding at the scale that NSERC can provide in the Colleges and Community Social Innovation Fund. And we have 3 full-time faculty working on the project. We've hired 25 research assistants from 7 different projects here at Humber. And we've worked with our partners, the Canadian Public Health Association and Canadian Students for Sensible Drugs Policy, while also printing out materials to make their way into retail stores all across Canada and presenting this research around the world at I think 5 or 6 different conferences at this point, heading to another one hopefully in May as well. And to bring all that together, to produce information that can affect all Canadians requires an investment, and we couldn't have done this without the investment that the Government of Canada through NSERC has made in our work and seeing the value in providing harm reduction focused education around cannabis. I think this project will have an impact in the short term and in the long term. In the short term, we hope that individuals who are consuming cannabis, either engaging with our materials online or talking with a bud tender who gives them one of our pamphlets in store, we hope that they have the information they need to not just reduce the potential harms of cannabis, because cannabis is not harmless, it is minimally harmful, and we can take steps to reduce those harms. And we're hoping that individuals who access our materials get scientifically based evidence that gives them practical things they can do to have a safer, more enjoyable experience with cannabis. We're very clear, we don't tell people that they should consume cannabis, but we say if you are consuming cannabis, here are things that you can do based on your situation, the frequency of use that you're using, the goals that you have for your use. Here are practical things you can do to reduce the harms that you have. And here's ways to reduce to break apart some of the myths that you might know about or use to help guide your practices. So I think in the short term, we're going to help people have better experiences with cannabis. And in the long term, what I'm really hoping for is that we break the paradigm of how we talk about drugs, because drugs education and discussions about drugs have, for the last century really, relied on fear and stigma, and that doesn't do anybody any good. And what I'm hoping that this project does is show that you can do a lot of benefit for people. You can bring forward information, you can improve experiences, you can have people stay safe without trying to scare them, without passing on unscientific information or even direct misinformation, and that we can move forward with drugs education really across all drugs: alcohol, tobacco, cannabis, cocaine, heroin, that we can talk to people openly and confidently about the information we have and with clear ways about how to reduce the potential harms that they're facing if they choose to consume. DARE is dead. It's never coming back if I have my way. And what will replace it are projects like this, which show how you can present information about harm reduction. You can talk honestly and without stigma, and you can make a difference in people's lives. If you want more information about our project, you can check out weedoutmisinformation.ca. On there, you'll find all sorts of content related to dispelling cannabis myths and promoting harm reduction practices. You'll find 30-something posters related to cannabis myths. You'll find 4 different pamphlets guiding people on how to use cannabis safely. And what you'll also find is interviews with 16 cannabis experts where they provide short 1 to 2 minute segments debunking different myths around cannabis. So almost all of our material are created by young people for young people, but one of the things our research showed is that young people also want experts to chime in. And so we've paired the written responses from our research assistants and people in the community who helped us draft the work and paired that with experts from across the world. We have French, Italian, American, Canadian, British experts all chiming in to help dispel different myths around cannabis and help promote safe consumption.